Hello and welcome to my presentation today. The topic I have chosen to delve into is fatigue in the perioperative environment. I believe this is a crucial subject that affects not only healthcare professionals working in the perioperative field, but also the very essence of patient safety and the care they receive. Fatigue is a multifaceted challenge in the healthcare setting that exponentially increases the risk of errors. In the perioperative environment, it takes on a unique significance. It's not just the typical tiredness we experience at times. It's a state of physical or mental exhaustion that can result from multiple factors and contributes to avoidable errors in practice, potentially causing harm or hindering a patient's recovery. In this setting, lives are saved in a time-sensitive manner, or meticulously planned surgical therapeutic interventions are performed. Fatigue in this setting can have far-reaching implications. For example, a surgeon, despite their expertise, is fatigued and on his last operation of the night forgets to inject local anesthetic at the end of his operation. While this may not cause a life-threatening adverse event, it is well discussed that poorly controlled post-operative pain is associated with increased morbidity, functional and quality of life impairment, delayed recovery time, prolonged duration of opioid use, and higher healthcare costs. In healthcare literature, there is a lack in unity in the definition of fatigue, as fatigue broadly spans physical, mental, cognitive, emotional, and motivational dimensions. A quick Google search tells us extreme tiredness resulting from mental or physical exertion or illness. A systematic review by Bilanez et al. Found the most common phrases used to define fatigue include disruptive, subjective, distressing, debilitating, exhaustion, persistent, overwhelming, lack of energy, and not relieved by rest or sleep. Let's talk about the perioperative environment in isolation for a moment. The perioperative environment encompasses the entire spectrum of surgical care, but can be broken down into three major components. The preoperative. This stage involves the patient's experience before entering the operating room. It's where careful planning, informed consent, and preoperative assessment occurs.
Created using Powtoon.